everyone. So thank you and welcome to the DHSS Reorganizational Committee meeting. I'm State Senator Nicole Poore, and I am chair, but I'm also joined by my co-chair, Mike Houghton. Mike, thank you for joining us. We have been playing phone tag over the last couple weeks. So, but Mike, thank you very much for all your support and diligence to join us for each of our meetings. I want to thank all of the task force members for joining today and for all of their work over the past year and a half. I know that this has not been easy, and I appreciate the fact that you gave pause in respect to the pandemic and the hard work that our secretary has had to work through and make sure that she was able to provide the services, the vaccinations, the information, the education. I'm sure, Madam Secretary, I am forgetting a few things that belong in there in the work that you did. I'm certainly appreciative of the amount of calls and texts that you took from me to help my constituents. So, but we did have to pause and we came back, and I think everybody was diligent to staying focused to the information that we need to provide. The four subgroups, the service to consumers, contracts, compliance and national best practices, and personnel, have met consistently over the task force's existence to find ways to improve the effectiveness and efficiencies of DHSS. Today, we will hear from each subgroup and their prospective chairs on the work and also final recommendations. As you heard me say earlier, we will vote after each of the chairs have presented their list of findings. Certainly, if anyone has anything that they would like removed or that we would like to open up for discussion, because each of you have had over 10 days to review this information that we will collectively pull to the side. We will have a conversation about why something needs to be removed or put on hold or put to parking lot. I would kindly ask that each subgroup leader try and stay within the approximately 5 minutes, so that way we can leave time for discussion, questions, and votes. After each subgroup presents and we vote on the recommendations that the task force wishes to adopt and put into the final report, this report is due by June 1st, 2021. So at this time, what we're going to do before we kick off to the subgroups is look at the minutes from December 8th, and I would ask for a motion.
I'll move for the approval of the minutes, and Madam Chair, ask after we consider that if I can make, excuse me, some opening remarks as well.
Absolutely, Mike, you were next on my list.
I'll second the motion.
Thank you, Sheila, I appreciate it. Okay, all in favor?
Aye.
Thank you. All right, at this time, Mike, I'm going to turn it over to you.
Thank you. Good morning. As Senator Poore has noted, and as I think most of you know, I am the co-chair of this review of health and social services. I want to say it's nice to reconvene after this long delay from the pandemic. It's good to see you all, and it's good to be moving towards discussing and finalizing these recommendations and wrapping up the work of the committee. First, I want to extend a sincere thanks to everyone at Health and Social Services, its contractors and providers, for the extraordinary work done during the pandemic at a time when thousands of Delawareans have been and continue to be in dire need of support, when jobs were lost, when financial circumstances have been desperate. DHSS personnel, contractors, and partners have stepped up even more. Countless hours have been invested, and at the humble salary of a state employee nonetheless, to help those less fortunate, those facing dire health and financial crises. Thank you all for your selfless and generous contributions to the people of Delaware. Second, I want to thank all the subcommittee chairs and members for doing all of this work during the pandemic. The recommendations we'll discuss today are robust and far-reaching. Some have been topics identified from the beginning that when our work began together. Better integration of services, responsiveness to customers and consumers, investment in technology, better standardization of contract solicitation, management, administration, and materially better rates and terms for contractors, among other things. As chair of DFAC, I know a little something about the expenditures and the current and projected fiscal circumstances for the state. It's in these next few years when we have resources that may well be available to address such concerns. Other recommendations, such as the separation and division of DHSS into a Department of Public Health and a Department of Human Services, and the creation of multiple new divisions, offices, programs, seem to me to be more complicated in many respects. Impact on personnel, administration, and the long-term fiscal ramifications. The ultimate decision as to how or if to accept recommendations from our group will lie with the Carney administration, the executive branch that has responsibility for management of the departments and agencies of state government, as well, no doubt, as the legislature, which will do a thorough review and approval of the budget at minimum in expressing its views. As we consider the subcommittee recommendations, then I caution all of us to not only recognize the needs that are often apparent and long-standing, but to consider whether the suggested solutions are efficient, fiscally sustainable over time, once this tremendous recent infusion, this sort of sugar rush of federal pandemic funding isn't available. And once the Delaware citizens have to pay themselves for what could be significant operating budget increases that arise from the creation of new programs, new offices, new divisions, and new departments. Thanks. I look forward to today's discussion.
Great, thanks, Mike. So at this time, we've already talked about the timeline, knowing that this report is due June 1st. And so let's get started. I'm going to turn it over to service to consumers.
Thank you, Senator Poore, and thank you, Chairman Houghton, and thank you both for your comments and for the work that you did. I want to recognize also my co-chair, Devonna Williamson, who worked so much on this when I saw our report. I want to thank all of our committee members who were comprised of frontline workers, advocates, and past leaders of health and human service agencies. I also would be remiss if I didn't recognize the 500 people who responded to the survey that we completed, and 248 of whom were DHSS employees themselves. And so the recommendations that we come forward with, that in Chair Houghton's terms were far-reaching and substantive, really emanate from the grassroots of those people who are on the front lines addressing service needs, and those individuals and families who have people who are suffering and who are in need of help and have difficulty navigating a very complex bureaucracy. And so with that, I would like to say that Secretary Margerick and all the division directors for their participation on interviews. So our recommendations, it's with both humility and compassion for individuals and families who are suffering and rely on DHS for help. It's also with an understanding that political wills are not always aligned with the two questions that our committee undertook in trying to develop these recommendations and to answer them. And as an aside, we can say political wills, as we saw with managing the pandemic with a president who resisted mask wearing and the disastrous effects of that. And so with that, we set political wills aside, and we did not factor that in our two questions that we seek to answer in making our recommendations. The first was, how can we best address gaps and needs for people in need? And the second question that we asked, how can we support the frontline staff and the administrators and supervisors working to address those needs. So the questions, and these questions served as the basis for our recommendations that was reached through a thorough vetting and through the data analysis that we collected, and ultimately a consensus decision-making process of the 12 individuals there. So our recommendations are not reached lightly. I'm proud of the work that was done. I'm proud of the report that we completed. We talked about organizational enhancements and realignment. We have 5 recommendations, and these recommendations include the first one and the highest priority was that, yeah.
Sorry, I don't
Am
mean.
I done? Tom?
No. I don't mean to cut you off, but what I'd like to do is just pop up the screen so everybody
Okay.
can see the recommendations. My apologies, I should have said that earlier.
That's all right.
So that way, each of you, as you go through, having the visual, even though you should have read these, will be easier.
Can
Okay.
everybody see what I have, the document, or can you see the surrounding stuff as well?
Yeah, that we can see it. That's great.
Okay.
So, and thank you, Chair Houghton, for mentioning this, although I can tell you're already opposed to it. But we did come to a consensus that DHSS is simply too large. It touches people from birth to death. And the clear mission, and the amount of divisions in the charge, and given the structure of other state agencies in the state, that it would be best to be more nimble, smaller, more nimble, to be responsive and more effective. So we recommended a Department of Public Health, especially given pandemic response, and a Department of Human Services or some other name, and to align divisions to meet family and consumer needs. Our second recommendation was to establish a new Office of Health and Social Equity to address the systemic issues of racism, discrimination, language barriers, gender disability that contribute to wealth, educational opportunity, employment, and disparities in Delaware. We recommend creating an Office of Social Determinants of Health and Wellness in the Office of the Secretary to coordinate across divisions. That was coordination across the divisions and the delivery of services for the most compromised and needy constituents. We recommended a creation of a division called Population Health that would monitor technology integration and data analysis. We found in our interviews of the division secretary and division directors that it exists in small groups. One is in public health, but there's no single department or division that oversees this data integration or analysis across the divisions. And we believe that this would lead to accountability to be able to address gap analysis, consumer complaints, and a focus on quality outcomes. We recommended separating the Division of Aging and Adults with Physical Disabilities by having individuals who are currently under the Division of Aging merge with divisions of visually impaired developmental disabilities and to be called by an appropriate name. Given the state's demographic as a retiring destination for many people and the boom in aging population, it was clear from the interview with the Division of Aging that there was not an ability to address the substantive needs across that population. Under customer delivery and outcomes, we spent a long time talking about that. There is no central depository for a centralized wait list for each service and division, so nor an analysis of expectant length of time to assess resource needs to deliver that services. So we recommended a demographic analysis of the population to be served and who is being served. It seems that at DHSS, they serve who comes through the door, not who could potentially be served. And there are many Delawareans in need who are not reaching the doors of DHSS. We believe that that DHSS needs to strengthen its relationship with education, the kids department, Medicaid, and DSAPID, especially for children who are transitioning to adulthood. And I know that Secretary Majaric talked about their focus now on person-centered services, and this is something that's being done. But it is in the critical transition periods where we found the biggest gaps occurring, and that's where the crisis and greatest needs are happening. A focus on building a safety net and dismantling benefit cliffs through policies and through legislation. This happens in multiple departments, and we had people from the public who testified to us and gave information where they were just simply cut off. And to be cut off, it results in confusion, red tape, and obstacles as to where to go. There was a strong desire to increase funding for home and community-based services. And the analysis is there in the recommendation as to the cost of having someone in a home versus being in a community-based setting. There were a lot of comments from employees and in the survey around racial, ethnic disparities, language barriers, and inequities in DHSS in service delivery. We recommended developing a scorecard on this to monitor progress on key indicators. And we did get into this. I know there was another one on personnel, but staffing levels, turnover, the timing to fill vacancies, compensation level, funding budgeted full-time positions, addressing benefits for seasonal casual, increasing loan forgiveness programs, expanding psychiatry and other medical residencies in Delaware, expand paid internships and fellowships, and focusing on more teachers. And so in that one, there was a lot of comments around, and I know that there's another division, task force that addressed that, so committee, but that was one of our recommendations. And to focus on customer service and quality measures of service delivery. You know, many times the HSS workers have to say no, people don't, but it's the idea is that if you address other quality service delivery metrics, then you can increase satisfaction. And we were looking at the inadequate staffing and unskilled staffing results in line staff trying to be more than is reasonable. It contributed to situations in which constituents and consumers were not treated with dignity and respect. There was unmanageable caseloads that were cited, use of outdated medical service delivery models. And so we recommended conducting real-time customer satisfaction surveys so that feedback was gained from constituents. And this was an opportunity for improvement as you look at the front lines. We also looked at standardizing the complaint system and following up and benchmarking to ensure issues are documented and addressed, and reports were disseminated so they can also use that for training purpose and to identify unmet needs. There was a recommendation to create 3 pilot service integration models, 1 in each county, to offer unified intake, assessment, and delivery of services to meet the needs of citizens regardless of their age, income, disability, and location, and to improve easier access to services, to blend state and nonprofit organizations in each county to work together in a more collaborative fashion based on a set of outcomes for all clients. And lastly, our last recommendation was to create a chief data officer position within DHSS to manage the technology and data needs for all divisions. And the fastest way that we believe to elevate the Office of Health and Information Sciences housed within public health to a standalone division to monitor epidemiology, family health systems management, health equity, cybersecurity, infectious disease prevention and control. And with that, I think we came up with a lot of recommendations, I really do think our committee worked exceptionally hard. I'm proud of the participation of all of the members, and I'm proud of the recommendations that we came, because we didn't come at this with a pre-drawn conclusion. The data that we collected, the analysis that was undertaken, and the pandemic gave us an opportunity to review each of the respondents' surveys, all of their comments. So we had rich qualitative data upon which to draw these recommendations. And with that, I close. Sorry if I went over my limit.
You did go slightly over, but you were on such a roll, we just let you go.
Yeah, it's not like the committee meetings where they buzz you after you're speaking on a bill and you're done.
Right.
So thank you very much. I appreciate your
No problem.
indulgence.
No problem. So, Anne, you and your committee did a tremendous amount of work, had a lot of thoughtful conversation in regards to responses back that you heard from people with inside the division, people outside the division, and ways that could be constructive in helping DHSS reach higher barriers. I would assume if the strategic plan was still operating and in full force, and forgive me, Secretary McGarrick, if it is, and I don't know that, then just the fact remains that I would believe that there would be some parallel responses of what this committee found and what you could be paying privately to have someone tell you the same thing. So I think that this group deserves a lot of credit, as do the other groups, as far as the information that they brought forward. So prior to going to vote, what I'd like to know is, are there any questions, comments, thoughts around the information that you have just heard?
Chairman?
Yes.
Here's my view, and Anne is not only an old friend, but she listens to what people say, and she's a pretty shrewd interpreter of my comments. I generally feel comfortable endorsing, I guess I'd say sort of conceptually, all of the recommendations, with the exception of recommendation number 1. And the reason is I am not persuaded that there's a demonstrated long-term benefit from this disaggregation of health and social services into 2 departments. So I will not support that. As to my willingness to support everything else, it is, as my opening comments, I think, reflect, and frankly, I've been consistent on this since the very first meeting of this committee. We need to do things efficiently, and we need to do things in a fiscally responsible way, and we need to be attentive to the administrative and personnel implications of shuffling the deck. I support the other recommendations as a recognition that there are needs that need to be addressed. I don't necessarily endorse the mechanism of new offices, new pilot programs, and the like, but I'm comfortable with that caveat, sort of embracing everything else. And I do think there has been an extraordinary amount of work done by Anne and this committee, and I applaud that. I just cannot support a recommendation at this point because I don't know enough about it. Which would separate these 2.
If I may respond, and Mike, we are old friends, and I appreciate and value our friendship very much. And so you opened your comments that I believe that there was already a pre-drawn conclusion around political will not to look at this open-endedly about whether the department should or should not be divided. And I'm sensitive to that. And I understand that's where you came from. But I do want to say that the essence of where we came from were the members of our committee were past secretaries, division directors, and at DHSS and why we came up with that recommendation and became our #1 priority was, it is apparent that the bureaucratic structure in DHSS is a vestige of the 1970s infusion of domestic spending by President Richard Nixon, of all people, who had, thank God he suffered from paranoia because he put a lot of money into social programs. And he thought if he kept people happy, they wouldn't revolt. But the infusion of domestic spending created this monolith, these bureaucratic monoliths that are frankly imploding upon themselves. And so there's a vestige of bureaucratic structures, inclusive of names. When I was there, there was a division of mental retardation, if you can imagine. I went to Canada to speak at the National Conference of Public Administrators. They were appalled that we still had a division called mental retardation. And so the fact is that you have all of these vestiges. And so the creation of new offices, the alignment of divisions is in response to the demographic changes, the changes in family structure, which is great from the 70s to where we stand today. And I appreciate and sensitive and understand the costs. Of course, we did not engage in any financial analysis or cost benefit analysis.
Right.
And it is painful doing those things, but it would behoove the citizens of Delaware, we believe very strongly, our committee came up with this as the first one, that this department is frankly too large because too many people are served. And other departments have been split in the state and including economic development. And so to really take the most vulnerable citizens in Delaware and have them subsumed into this unbelievably difficult organization to navigate, that even workers themselves who put into the survey and said, it is difficult to navigate the system and get help for the clients that I have and the persons in need. So that's where that came from. So I understand and I'm sensitive to this. I don't know if Dr. Williams has any comments, but I do want to thank her for her steady leadership and support throughout this process.
And let me just sort of address to the extent that
you and I could debate all day.
We could, and I don't intend to drive us into a ditch by doing that. But my view is not just sort of think of it this way, protectionism of the status quo in the Carney administration. My view is that I'm not persuaded that breaking things up makes them better any more than combining them does. I mean, during the Miller administration, we created, or there was created, this megalith of OMB, which has subsequently been chipped away. I think the core operational issues need to be addressed, as opposed to what sometimes is a view that by disaggregating and shuffling and then restructuring, that the core problems are addressed. I think personally that significant additional funding across the board is necessary to support health and social services and everything that it does writ large. But I don't have the checkbook, and those aren't my decisions. Those are other people's decisions. It's not an indictment of the good work that's been done by this subcommittee. And it truly is comprehensive and important work. But to do this without connecting it to the fiscal side of it, and I'm just one member of this committee. I happen to be a co-chair, but I'm one member.
Okay, and I would like,
yeah,
and you know, I appreciate that, Mike, and I'm sensitive to that. I'm going to go back to my professor at the University of Penn when I was getting my master's in public administration. He always called it an idea and concurrency. He really said that government responds after the community, the nonprofit, the public sector has moved to solve a problem. And the fact is that I appreciate you're looking at it from a money perspective. I'm going to reference where we are looking at it. What is in the best interest, our core questions remain. What is in the best interest and how can we address the gaps and needs of those individuals and families who are suffering? And then how can we support the staff who are delivering those services? Yep. Those two questions formed our recommendations. the idea of money is one that can happen later. The recommendation itself, this committee is not charged with finding the money. It's charged with making the recommendations based on Senate Current Resolution 65.
Enough
John, I
debate
saw
for
your
me.
hand. Oh, I'm sorry. John, I saw your hand up.
Yes, I'd like to respond, I think, in a theoretical way to Michael's, some of his comments, not about the separation issue, which I'm prepared to support the subcommittee's recommendations on that. That's not what I want to talk about. What I want to talk about is, and I think that I've been an advocate for marginalized and low-income folks for the past 35 years. And it's always every attempt at improvement and reform and expansion of services and benefits to the most vulnerable members of our population has always been met with, we have to consider costs and efficiency. I think the pandemic has revealed longstanding fissures in our society that were apparent before the pandemic, but have come to the fore. And I think this subcommittee has done an incredibly good job of identifying some of those barriers. And while I think ultimately coming up with the funding is a matter of, to support the various recommendations of this subcommittee regarding the consumers, it is a matter of political will. And if we have the will to get it done, we will get it done. And I think that this is an important step in identifying needs, in setting out as a legislative task force the incredible barriers that consumers face, the most vulnerable amongst our population. And I'm going to say this, even though DHSS is a huge organization, they are grossly underfunded in terms of the needs of the people they serve. They could be twice as big and there would still be unmet needs. And I realize that we have to have fiscal responsibility at some level, but fiscal responsibility cannot be on the backs of the most vulnerable members of our society. And I wholeheartedly support all of the recommendations made by this very important subcommittee. And I think that the work that they have done is stunning. And I just wanted to indicate my endorsement of it. And again, that there is a time to have the political fights about where's the money coming from and how do we get it. I don't think that's for us to worry. That is not my concern today.
Do I see any other hands? Okay, so I see Devana, and then I see Lolita, and I thought I saw a third one, Carolyn. So Devana, if we can go to you first.
Thank you. I'll be brief. I just wanted to reiterate a couple of key points that Ann has made, and that is that first and foremost, this was a gap analysis, and we did look at the barriers and obstacles and determine what came out of our work. And so the recommendations follow that whole intent of analyzing the gap. So as was said, it was not our intent to really look at any of the fiscal impacts, but I also would say that in terms of the overall recommendations, it would be our expectation that we would look at how those recommendations align with the existing work that the department has undertaken in strategic planning, and that also these recommendations may occur over some sort of a phased approach in terms of implementation. So when it comes to perhaps separating the department, that might not be something that would happen in the short term. Perhaps it might be something that would happen in the long term. But this is what came out of what we learned. So I just wanted to make those points. Thank you.
Thank you, Devana. I appreciate that. Lolita?
Thank you, Senator Poor. Good morning, everyone. I'm going to make a comment. I do support the comments of Michael Houghton, and I couldn't have said it really better, so I'm not going to repeat anything. But the main recommendation that I have a problem with, or maybe can't recommend or can't support, is the first one, and the dividing of the two making two departments. And I come from a healthcare delivery perspective. And if anything we've learned from this pandemic, it's how important the social determinants of health are to healthcare delivery. And I think the separation of public health from DHSS and human services, I'm not convinced, let me say it this way, that that would improve, other than perhaps make it more siloed and more difficult. I agree with Anne when you talk, excuse me, when you talk about how difficult it is to navigate across these divisions, but I would approach it in a different way. And I think some of your recommendations do address that in terms of the IT infrastructure, the data collection, the ability to bring the department up to the 21st century in terms of collecting data, cross division data, one source of the nonstop shopping. I would invest in that IT infrastructure to help all the divisions communicate with each other. So I would approach it sort of in a different way. There are, I think, 3 or 4 new offices proposed, and all of those subjects, the purpose of those offices are very important. I'm not entirely convinced that that wouldn't further silo these efforts. And in summary, and I should have said it first, Anne and Devana, thank you so much for all of the work and all the committee and all the qualitative data you've collected. And I appreciate the work. I also humbly apologize that I wasn't on your committee, so my words can be taken with the grain of salt if you like, but I'm not sure I can recommend separating the first recommendation. I'm not sure I could support that. Thank you.
Thank you, Lolita. Carolyn, and then we'll go to Secretary McGarrick.
Well, that was going to be my #1 question, was that I would like to hear from the Secretary, just overall perspective, because I did read all the information from the interviews that Anne's team collected, and it is amazing what you were able to do. I mean, yes, granted, we had an extra half a year, 3/4 of a year to do it, but I know the workload in contracts, and this is obviously an immensely robust report. So I very much respect the work that you and your subcommittee were able to do. There's a couple of things specifically that I have questions on. I'm not convinced. I don't believe in separating into 2 departments. I'm not convinced we should. What I would like, and I realize this could not have been done at the subgroup committee level. I would like to see, or I would recommend, I guess, some sort of fiscal analysis of what that would look like. Because what I don't necessarily feel comfortable with, knowing how funding across service lines is so incredibly strained. If there was a solution to that, if we were on a pathway, on a set pathway, that we've identified this funding stream, or we know how we are going to bring funding for services over the next, even if it wasn't immediate, over the next several years, or we have a plan on how we're going to address the major significant gaps in funding to services, or there was something that said splitting into 2 departments, or creating these new offices, or merging these divisions, laid it out that these are the cost savings, or this is the net zero, then I'd feel more comfortable saying yes. So I don't necessarily feel against any of these recommendations, with one exception, and I'll talk about that in a second. But but I just feel like I need a little bit more information. I would love to see some sort of cost benefit analysis on what two departments look like. What efficiencies does that save? There was so much information on this. I mean, there were so many great points to be made about antiquated offices or programs. And I think that is all really wonderful and things that could be very beneficial in reducing duplication or making positions that really need to be compensated. You know, you get what you pay for. So compensating state employees for what they're worth is just as important as compensating, you know, my providers in disability services or anybody in the workforce, nonprofit employees. I feel strongly about that, but I feel like there's a step missing before we can move completely into yes or no. The only other thing that I feel strongly that I can't vote yes on is merging DDDS with other divisions. There's already a task force assigned to looking at the functionality of DDDS. And I feel like they have been knee deep in their work as long as we have in ours. And I feel like that is something they have a perspective and they have a knowledge base that I wouldn't presume to be able to say that we know more about the future or the structure of that very incredibly important division. So if there was, again, if there was something, this is how we can merge resources, or this is how we can make more efficient the inner workings of the administration of those services within the division by doing this, then I could be convinced. But that particularly, I feel like there's already another group looking at that, and we should defer to them.
Thank you, Carolyn. Secretary McGarrick.
Hi, everyone. Good morning. I just want to echo the comments. I mean, this is such an incredible amount of work, and just everything that was done, and really the tone and the spirit with which this was delivered was just really exciting. And I think I obviously won't speak on behalf of all of the employees. I'm sure, you know, we've attempted throughout all of this to distribute and to share. And I think we have some state employees who are probably watching today. But I think what I was so excited about the report, because there were so many areas of agreement around service delivery. You know, how do we do things in a much more coordinated fashion? How do we make it easier for people? We frequently say at DHSS, people don't come to us on their best days. They come to us at a point of personal crisis, family crisis, or challenge. And so it really is incumbent upon all of us at DHSS to constantly be thinking about how we do it better. It's the pandemic has taught us a lot, and we have had a lot of changes at the department, including, like, surprise, new cabinet secretary. That was not expected, but I do think we've made some really good progress, and really a lot of that progress and the things that we were able to do during the pandemic around communications and streamlining contracting. And I know that's another conversation, so I want to be brief, but really was informed by the conversations we had via this group and some of the initial reports and subcommittees. So I just, again, really want to thank you all and acknowledge that, you know, reasonable, dedicated, smart people can disagree on two departments, multiple departments, divisions. But I think what I hope you all hear from me today, and I'm confident that I'm echoing our division leadership and many, although not all of our state employees probably, so I want to leave room for that disagreement, in that, you know, again, a lot of these recommendations and the spirit of the recommendations and the goals, there is so much alignment and clarity and synergy around where we have to align, where we have to evolve, what a 21st century agency looks like. So I just, again, I got this and was just really excited about seeing in it a lot of the work that we're doing and a lot of the work that we've done with you all during the pandemic, and just really excited about the future of our department and continuing to strengthen the partnerships with each of you, the groups that you all represent. So again, just wanted to really thank everybody and acknowledge like lots more conversations to be had. Absolutely a lot more work to do. But again, I think there's much more alignment than there is disagreement in where we need to go. So thank you.
Molly, I just wanted to say my appreciation to you, and I think that the committee should know the hard work. You were very responsive. We had a lot of requests for data and information, and you were very forthright when you had the data to provide it. If you couldn't provide it, you let us know why or when we could get it. And in helping disseminate the survey, it really led to a really good process. And so I really want to express my appreciation to you very much, and to the work of the division directors. And if you would convey that for them and their reports that they provided. We asked substantive questions and reports that everybody provided to the committee. So thank you very much.
I saw Representative Johnson and then Sheila.
Thank you, Senator Poor. Ms. Williams and Ms. Farley, this is a lot. Like I'm sorry, let me put all of my devices on mute. Everything's going off at the same time. I want to say that I appreciate all of the work and the time that you spent putting this together. And it is clear that a lot of work and thought and evaluation went into this. And Ms. Williams, you talked about the gap analysis. I have so many notes up here, it's ridiculous. I started on my phone and then I ran out of space, so now I'm writing. So please just kind of bear with me as I go from my telephone to my paper, because I've actually run out of space. I wanna, so again, thank you for the work. My first thoughts are that I listened to, some of the things that co-chair Mike Helton, I'm looking here to see you, there you are, stated are some of the things that are of concern to me as well. I part of me, and this is as it relates to the very first recommendation, and then I'll go down based on the notes that I have here. And looking at the gaps in services, I also have to wonder that why not address what the core operational issues are before we move to, well, this isn't working and let's just merge these things. The other thing that just really lays on me as I reflect back in my previous role as an executive director who had to look at programs and needed to do a cost analysis. It's difficult for me right in this space to just say yes to number one when I really don't know what that looks like. And that is concerning to me. And ladies, look, I don't want to take anything from you. I get it. The beauty of what you did is that you didn't have to think about the money, because if you just thought about that, the list would probably be much shorter. But when I think about the recommendations and I think about moving forward, like, what does this mean? How much is this going to cost? How does it impact other services? And how does it impact other funding gaps that we already know exist? Ms. Williams, one of the things that you said, and I liked, and perhaps that would help me be able to get behind the first recommendation, is that you said something to the effect of perhaps being able to phase some of these things in over time. That if we had that type of plan with some of the recommendations, I would be more likely to get behind them. So I wanted to push that out there. So those are my thoughts regarding number one. The point, and I can't find it, I have my computer up, the actual PDF up here in front of me is at the same time, related to merging particular divisions, the SAPIT, DDDS. Carolyn spoke to it, and I'll speak to it a little bit more, the DDDS task force. And some of you may be aware that myself and Senator Hansen, we co-chair the DDDS task force. And like this particular group, we too have been feverishly working and evaluating and putting recommendations together. I will tell you that that task force, our recommendations, where we are, they've already been reviewed, compiled, and agreed upon. So we are like so close to the finish line. And I would be extremely concerned to think that the work that we've done in evaluating the entire DDDS system could then just be pushed to the side because now it could possibly be merged with something else. I would like to see the recommendations come from that task force and that division begin to work towards that end to close the gaps and to better serve the individuals receiving services, as well as have better, more cooperative, which they're working on that now, relationships with their partners. That's my 2 cents on that. Secretary McGarrick, your comments, you said that there were more alignment versus disagreement. What I'd be interested in knowing, and if you felt comfortable, is what were those alignments and what were the disagreements? Because while I may have some very strong feelings, I don't want to say feelings, thoughts after my analysis, I would respectfully like to know your positions on particular points, because ultimately, like this is all of yours. And how then does it, where are those places where there is a complete alignment versus a disagreement? And can we also have discussion about those things? Because if you're saying, well, this could happen, this could happen, this could happen. And if it's something that I don't agree with, then I can take a step back, reevaluate it, and make a different decision. So those are my 2 cents for now. That's a lot, I know. But again, like ladies, this is tremendous work. It really is. So thank you for your efforts.
Secretary McGarrick, would you like to respond?
I'm happy to. I've struggled with all of this even today, like what to say, not to say, because I don't want to influence the committee. I think this is a really important discussion to have. I think Anne pointed out, these are really critical issues. So I'm happy to, but I don't know, it's sort of odd even like how to vote on these because some of them have a price tag. And as a member of the administration, I have to think about that, but I don't, again, like what's the spirit of what we're voting on? So I guess I'm struggling a little, Madam Co-Chair. I'm happy to walk through, but I also don't want to stifle discussion or not leave room for others if it's helpful for me to I don't know. Like I said, I'm happy to do high level, and if we need to dive in more, if that's okay with you. I also, again, want to be respectful of the other subcommittees and the rest of the time on the agenda.
I respect your response, and it wasn't my intent to put you on the spot, but I guess
no, it's very legitimate, and I'm happy to. Sorry, I didn't imply it was a legitimate question.
I would defer to the rest of the committee members because, like you said, you don't want to be in the position of having to, influence. But at the same time, when I put on my previous hat, I would like to be at that table if someone is making decisions about the operations of my program. So I would defer to other members to see if they were interested. Otherwise, I will sit here quietly and listen. So thank you.
So I'm actually going to concur with Representative Johnson. I think that, Secretary McGarrick, these recommendations are coming from a group of people who have spent months reviewing, and, it would be helpful if you can even share any details, right? And the reason why I say that is because it may formulate a different opinion to the fact that maybe as we were constructing each of the pieces to bring this together, that some of the stuff might have already been accomplished, is in the process of being accomplished, or is in a strategic plan to say, this is what the goal is in year 2, 4, 6, and will give some comfort to everyone.
Sure.
Yeah, I would agree. One of the things that when we were pulling together our recommendations in the contracts subcommittee, I wanted to make sure that we put together recommendations that were thoughtful and specific, but not so specific that they couldn't be operationalized, that there wasn't enough flexibility to be operationalized in DHSS internally, because we recognize we don't necessarily know, we're not doing the job, so we don't know how that translates into actually becoming an achievable objective. And I know, Secretary, that you are doing a lot. You have made a lot of changes, and you are doing a lot since you've been in your position since last summer. So, knowing that some of these things align with your internal objectives and your internal strategic planning would help, and not in an influential way, but in an, all right, well, that aligns with what external stakeholders are seeing and what internal stakeholders are seeing. And I know that Anne's work did go through and interview so many people within the department, and that is really helpful. But, there could be some sort of, happy medium with some of these things that I think would be helpful for those of us that are maybe teetering on one side or other. For instance, I do think there needs to be whether it's called this or not, in terms of number 3, an office of, no. Where am I? Wellness, yes, determinants of health and wellness. I have felt from the beginning there should be an office of the health advocate, or somebody that's not politically appointed necessarily, that their main goal is that overarching, are the clients of DHSS, are the Delawareans that are being served by DHSS being served, and what are the obstacles, and that their sole job is to, removed from political appointment, or removed from, fiscal objectives of an administration, that is their sole goal, sole objective, and that their office primary mission is to, so whether we call it, whatever we call it, but if that might be something you are already internally talking about, or your position is, this is why that can't work, or this is how we see that role, and those kind of things are happening. I understand your point as far as not wanting to influence us, but I think where there is things that, where there are things that pop out that, we are moving towards this, or we are moving, or we've tried that, and that might not be why this works. If I feel strongly about one of these things, I don't know that it would sway me one way or the other, but it might help inform where we don't have that much personal interaction with it.
Secretary McGarrick, before you answer,
Sure.
would it be okay if I let Sheila go? Because then maybe you can just make a full statement at the end versus going back and forth, and not making it out as a debate, or not making it out as you needing to defend, but more so of informational and educational to the committee. How's that?
That is exactly, thank you so much.
No
That's
problem.
really what I want to do. I don't want to come across as I'm trying to
Got
talk
it.
you all down from specific points. So thank you for understanding. I appreciate that.
Yep, no problem. Go ahead. Whoops. Go ahead, Sheila.
Thank you. First of all, again, I echo what everyone has said about the immense work and how important that work was, especially at a time where we have just experienced, one of the greatest health crises we've had in years, and how it's going to impact so many people, possibly for decades, because of how this pandemic has impacted them. I'm going to put a little bit of my organizational perspective on. I think that the recommendations that were brought forward were very thoughtful. I think as Anne had mentioned, they were designed to specifically identify how to improve services. I also think that if it's, again, I don't have all the history, but if the structure of this department has been the same for 30, 40, or 50 years, and the fiscal ups and downs that the state has had, I know that when we hit the Great Recession, there was massive reductions without possibly really rethinking how to deliver services. And then I add that we're at this moment where in so many other parts of society, we're saying, what's going to be our new normal? It seems like this is the moment to step back and say, what should this look like going forward so that we can deliver services, that we can do it in an efficient and effective way. And the committee recommendations that it brought forward, it would certainly not be responsible of us to just blindly say, yep, do it exactly this way, but perhaps rather say, could we say, these are the recommendations that have been brought forward, and we recommend that investments be made to evaluate whether these are the right choices, right? So the recommendation is that we suggest that these be evaluated to determine if they indeed can perhaps improve the quality of our delivery, to integrate better, to capitalize on new technologies. I don't think our committee, we don't have enough time to go through and start to say, this is the right decision or this is the wrong decision. As much as what I think we could do is say, we are bringing forward these recommendations, and as such would request that funds be set aside to conduct the next phase of the analysis, which is for Molly and her team, and possibly, the consultants that do this kind of work, to really understand, would these investments, would this restructure improve the delivery? So I just want to be mindful that we don't have all the data and insights that we could determine if breaking apart the department is the right approach. But I also don't think we should just say we just disagree and we shouldn't explore it. So that's where I'm at, is that this is our moment to take advantage of the fact that we've all experienced change in such a rapid way. And as the secretary said, they've already made some changes, but they were done in incremental steps. This is the first time, I think, in the recent history that we're actually looking at this holistically. And I just think that it's a moment for us to offer up a holistic view of what could be possible, and then recommend that the evaluation take place to see if what could be possible is indeed going to be ultimately better. Thank you.
Thank you. I do not see any other hands up. Secretary McGarrick, would you like to make a closing statement in this piece?
Yeah, I guess it depends on the vote. So I want to try to, how do I talk about all the things we're doing and run through, I can just quick run through the recommendations. So I think the divide DHSS into two departments, I do struggle with this one because, again, all of the points that are raised are valid. But to me, and what we also hear from people, is that they view us as the state. They don't, divisions to the people being served don't matter. They are like, you're the state, figure it out, coordinate, do what you can. So that's where I struggle. And I agree with Lolita in the sense that all of the research on social determinants of health says that you need to think about, when you're talking about healthcare, what really matters is, do people have housing? Do they have food benefits? So divorcing and separating is sort of how we've gotten into the mess of a really expensive healthcare system that doesn't actually keep people healthy. So that is really where I struggle. I think the integration of social services and health, and acknowledging that really these are the same, roughly the same population of people moving across divisions and frankly departments, DOC. So to me, again, whether it's 2 departments, 5 departments, 1 department, it's really about knocking down barriers and actually integrating, not collaborating, not saying, oh, I called them on the phone. Where is actual legitimate integration so that this side knows what this side's doing and there's an actual transition plan, or whatever the case is that we're talking about. And to that extent, we've stood up cross-divisional groups that really started with the pandemic, but have shown us that we need an interagency task force on housing. So it's pulling all of people across divisions. So we are actively and aggressively taking steps, and I could not agree more with the why. Again, the how, maybe where there's legitimate, appropriate disagreement, 2 divisions, 3, all of that. Office of Social Determinants of Health and Wellness and Population Health. I'm going to bucket some of these because and this is actually in that one of the other committee recommendations. What I am focused on doing is realizing that in some ways we are a little bit the federated states of DHSS. Where do we need to pull things up on a department level? And I could not agree more, Carolyn, around compliance, contracts, so it's hard. I'm like trying to pull all of it together. But we need to be looking at areas where if there's 3 divisions doing the same thing, why is it separated into 3 different divisions? Can it be pulled up at, and not necessarily even my office level, but how do you pull things up across the department at a department level that sit as an umbrella across? So again, compliance, contracting, anti-racism efforts, social influencers of health. Like, how do you make that really the onus of the entire department, but have dedicated people focusing on it that then are talking to the divisions and pointing out areas where we're not achieving the mission. A new division of aging. I think again, there's opportunities to have like divisions with like populations and like services work better together, whether that's integrating some of the back office functions, but the subject matter experts stay in divisions. I, again, could not agree more that treating these like separate siloed populations does not lead to better service delivery. Centralized wait lists. We actually did some of this with the pandemic. We had 211 being the where people go, and then it came back to us. Absolutely love that suggestion, have taken some steps, want to do more. Engaging with other divisions, poor Steve Groff. I'm like, we have to clone you and like 80 other Medicaid staffers. To me, Medicaid is really the thread that runs through our entire department, even social services. How do we actually acknowledge that and structure that into the work we're doing so that Medicaid isn't so much an afterthought of like, oh, we needed someone to pay for it. Let's go talk to them and get their checkbook out, but actually say waivers, policies, state plan amendments. How do we use that to actually drive the innovation in public health, in social services, all of it? So we, again, active steps in that direction. And sorry, I'm going to speak on behalf of Director Groff, but I mean, he and Lisa have been all in, and we have some position reclasses that we've submitted through DHR and OMB that again, kind of were pre-pandemic that we're looking to pick up, and some have already started coming through. So again, concrete action, not just trying to give you lip service today. Kids department and DOE, absolutely. Kids department, we're having specific conversations around the transition of services. What does that look like, and where have we created barriers that need to be worked on? Safety nets and benefit cliffs. I know John Whitlaw and I have had conversations about this. I really do think we need to revisit again, where there's more federal flexibilities and maybe where the state isn't being as generous as we could be, but that does have economic impacts. So again, happy to keep having those conversations. Increased funding for home and community-based services. I mean, we agree. I think where we get stuck is in the how in terms of the funding, but these are partners. We can't do these services without these provider partners. And so if we're weak and they're strong, then collectively together, we're not doing everything we need to do. And if they're weak and we're strong, or unfortunately, the scenario we're in right now where we have weaknesses on both sides, that's not in the interest of the people we serve. Totally agree. Again, racial ethnic disparities. There was something that went out from the governor's office, or excuse me, DHR, to all state employees where they're doing listening sessions and a climate survey specifically looking at race, anti-racism, ethnicity, language barriers, et cetera. We had been having individual conversations with DHR about how we do that specifically within DHSS, again, probably last fall. And really, there were so many other cabinet secretaries that were saying the same thing, that DHR is doing that as a united. And it was an email that came directly from the governor. So it wasn't just, you know, let's just kind of do some things. It was, we are doing this and we are going to make changes. And again, we wanted to do it on our own, happy to do it as a collective. Staffing levels, turnovers, and vacancies. I don't want to speak on behalf of DHR, but this is an issue that is larger than DHSS, and we have raised the specific challenges for DHSS and are actively having that conversation. Some of it is the merit classifications are out of date. It really is bigger than us, not to say that we don't have a responsibility to work on it, but it's unfortunately not something that we can solve in a vacuum. But again, I don't think any of these things are off the table or that we disagree with. It's just a question of, again, the extent we can do things on our own, we've tried to do it with our funding, especially around, you know, some nursing, some bonuses and hiring bonuses for nurses to try to incentivize people to come. And we've had conversations with DHR and OMB where it's going to take more collective action. Service and quality, service delivery. Yes, we have scattered. Like I know Senator Poor, you know, former Director Ray Fitzgerald did a ton of customer surveys. How do we, again, take that up on a department level and not be like, oh, we have this rock star division director doing it, no one else is doing it? How do we learn from each other, and where there are things that really need to be happening across the department, we pull it up as a mandate with training, with support to get the rest of the divisions to be doing the same thing. And I'm sorry I skipped over one around data. Absolutely, 100% could not agree more. And I know Medicaid, a lot of our divisions are struggling with this. We have to do a better job of being a 21st century agency with data integration. I love the idea of how do we look at, again, what we already have, raise it up and build on it, and then support it out. So sorry, that was like a speed lightning round of me talking really fast. But that's where, like, again, part of my talking fast is I'm really excited. Like, this is such great work. And it's a roadmap that really aligns with where we're going as a department. So again, some of the how, we may disagree, the timing may be a little bit different, but I think there's so much more there where we have come to collective agreement around it, the fact that why we need to do this and where we need to go.
Thank you.
Sorry, and I'm happy to talk a little more about any of them. Again, was trying to be mindful. And I think some of them, again, do pop up in different iterations in some of the other subcommittee reports.
Which is, I think is also amazing, right? Because I'm not going to ask anybody to raise their hands, but I don't believe that there were interactions between the committees. I think when the subgroups met, they met. And I don't think that they were, I don't know, I'm not aware of it, that they were cross-referencing each other's subcommittees. And so when you have different groups that actually can pull the same end result or the same philosophies, same thoughts in how a policy or process should work, then you have that's your common thread, right? Different groups, different people talking about the same thing because somewhere along the line it affected them or their constituents or them personally. You know, really, I think stands to how well this task force operated together collectively, but also in their subgroups. Did I see any other hands up? Okay, so we are starting to crunch down in time. So let me ask this. We will go back to the vote for the separation of the division. Again, please keep in mind to this committee, these are recommendations, right? These are thoughts that came out of your committee supported by data and the workarounds of what your committee brought forward. So Devana, I believe it came from you, and I appreciate this. What you said is that they're recommendations. It doesn't mean that legislation is written tomorrow. It means that the line of communication is open. We're hearing the secretary match that with some of the things that she's moving forward to. But technically, we're at a point of needing to close out this this proposal to give to the legislative body. So it sounds like everybody is in agreement with all of the recommendations, but number one. Is that what I'm hearing?
I think that's right. Although, Nicole, I guess the only thing I would note is that, you know, what we've heard is some of these are being addressed. People like the concept of the issues addressed, but not necessarily creating a new office or the like. So in that spirit, speaking for myself, I can support everything but one, understanding that my vote is really kind of to the identified need as opposed to whether it should be implemented specifically in the way found in these recommendations. But I think generally you're right.
Well, and I think, you know, Mike, to that point, here's the reality of this, right? Is that again, we're talking about ways of improvement. We're hearing the secretary say what some of the improvements are going to look like, how we're going to start feeling different things. So I don't think that your thought process is wrong in that point of view. And I apologize. I see Courtney's hand up, and I don't want to ignore her and just keep rattling on. Go ahead, Courtney. And then Ann.
No, you finish your thought. Finish your thoughts, please. I'll wait.
Okay, so I think that, you know, when we are looking at this, certainly the money is going to factor in, right? We're going to have to figure out how to upscale different salaries. We talk about it all the time that there are a lot of state employees that are not paid to where they should be paid. And we understand that there's going to be a fiscal responsibility. But overall, this committee, their responsibility is to be able to take the information that they've heard and that they've learned, put it down into a document, and then from there, collectively, we have to figure out what that looks like. But I don't think that that's without conversation, multiple conversations. Look, you know, where I was over, you know, a year and a half ago, I think we've seen some really deep dive into the health and well-being of our state and how we're providing those services and how we can do it better. And not saying that it's not without people getting what they need, but there are some gaps in there that we need to make sure that we are closing. Okay, go ahead, Courtney.
Okay, thank you. I just wanted to say that I am the newest member of the committee. I'm representing the Office of Management and Budget. So as I read through the material, I probably looked at it through a much different lens than the rest of the task force did. I just wanted to let the group know that at this time, I'm going to be abstaining from voting on the recommendations as presented, simply because several of these recommendations do have a fiscal impact. And I was happy to, I hope I didn't miss the cost benefit analysis, but I believe someone earlier said they didn't quite get there yet. So I just wanted to let the group know that I will be abstaining, and I hope you all understand my position on that.
Thank you. Ann, go ahead.
Thank you very much, Senator Poor. Thank you, everyone, for your very insightful comments and feedback. You know, given our recommendation on one, which was very concrete, I don't know if the committee would entertain changing the word from divide DHSS into two departments to explore whether or not to divide the department, and that Secretary Majaric could work with the legislature, OMB, address the cost benefit issues that Michael brought up, as well as the phasing issue that a timing issue, because and its fiscal implication in the out years. I think Governor Carney has been very, as has the legislature, been very sensitive to what are the long-term fiscal impacts of changes. And so I don't know if we could maybe reword that in a way that would be palatable for the committee itself to accept the recommendation. I would hate for us just to do an up and down vote when in reality, what this body has seemed to get to consensus on is that it does need to have further exploration.
Okay, and we're gonna put that in the parking lot for just a quick second, because I want to go to Representative Johnson.
I'm sorry, I'm gonna take it out of the parking lot. And I like the thought of rewording and adding explore. And with that, I would, because I initially my hand was up because I needed to say that I could not support the statement related to merging DDDS and DSAPIT and others because of all of the work that has been going on over the past year and a half as it relates to the DDDS task force. But if we're saying explore, then I am open to exploration that would provide me with the additional answers that would ultimately lead to some comfort. So thank you for the opportunity to share.
And I also do think that Molly, what you're working on, all of the things you're working on, it gives you a chance to, with your strategic plan, to really dive into the questions, because our gap analysis, and I just want to encourage you, I know, because you're so caught up in the bureaucracy there and it's so big, but our questions remain like really at heart. What is in the best interest and the needs of the people, that are getting services and suffering. And for somebody who just anecdotally has worked for years now with a young woman who was aspiring in college and then was diagnosed with schizoaffective disorder. And I just had DHSS help me get her back from New York back to Delaware. If you have to navigate that maze, it's difficult. And so having your staff and work with the legislature, work with OMB to review this. Thank you, Representative Johnson, for your openness to not shelf this.
Monica, I'm sorry, Secretary
No, I
McGarry,
was just
go
gonna
ahead.
say, I totally agree. And I think with my team and others have become a little bit of a broken record. It has to be human-centered design, which is a technical concept. I'm sure Sheila, and Anne and others, but really it's how are you designing the services to the benefit of the people being served, not the continuation of whatever. It's what needs to change to actually do what we all say we're here to do. And I know the DHSS team is here to do. And so it's getting things out of their way and consistently bringing it back to, and I think you said it so well, Anne, not getting caught up in the why or the how or, oh, well, what if we do this? It's who is at the center of this work. And it is the people served by DHSS, some of whom unfortunately are also the people who work here, which is another issue that goes to some of the personnel comments, but I could not agree more with you.
Monica.
Thank you, Senator. The work that's been done is tremendous. And certainly I understand some of the data that was found in personnel. We have been working with DHSS at DHR for quite some time, trying to address, and not only at DHSS, but in other areas, many of the issues that have been brought up. But I wanted to also state that I began as a designee for the former DHR secretary and somehow became appointed or representative. And I really am more of a DHR SME. And I do have concerns about this recommendation in general, because I can't divorce myself from cost also. So respectfully, I am going to be abstaining from voting. Thank you.
Okay, so the word play to what Anne has offered, does that work for the committee?
Yeah, speaking for myself, I think I could support the idea of exploring whether dividing DHSS into two departments, fill in the rest, is feasible, is capable of being implemented, constitutes good policy or whatever, because I think, frankly, I think that could be the predicate to virtually everything else that's in this committee's recommendations. I still chafe at the idea of a concrete and specific recommendation to create an office or to create a division, but with the right kinds of predicate language to a final report and with an understanding that this is all malleable, movable, things have happened and are happening, I could support that modified recommendation.
Okay, so let's, not that I want to take too much time on this. Oh, I'm sorry, Secretary McGarrett, go ahead.
I was going to say, to the extent that it's helpful and also gives the committee comfort, we're happy to, or to ask like friendly amendment. I hope that, you know, the department provides an update on these, because I know that again, there was a lot of concern expressed around, well, is this aligned, is it not aligned, you know, and understanding where we are, again, to the extent that it's appropriate and helpful and actually, again, puts concrete action on the table. We're happy to accept and participate in a recommendation that that an update or a report on the items addressed in here, or the concepts addressed in here, be submitted.
So hold that one, because that might be for the whole picture, right? On all of the, not necessarily all of the recommendations, but like an annual report, which I think you'll hear a little bit more about. So can we parking lot that piece of it? Let's go back to the recommendation part. Can we get a favorable response on the wording? But I want to make sure that we're clear what the wording is. And Alexa, I want to make sure that you have it so it's correct for reporting purposes. Lolita, did you want to comment on this piece or?
Yes, thank you, Senator. I'm more inclined to support it if it's a softened word in terms of where we're going with this. I do question, my question is, who is going to consider this and continue the work? I think a lot of the work has been done in terms of this kind of a group. I'm not sure that work, if it goes into DHSS's office, is that part of their strategic plan to look at that? I don't want to add another requirement to them. I'm not sure I could still support it. Also because, you know, some of the other words I have a little bit of a problem with around the creating of new departments, because that goes back to the fiscal responsibility, and maybe soften those as well, that create word as well. I'm not totally there yet. I'm not sure what the next steps would be to that recommendation versus we're going to divide it.
Sure. So I think that is, those other creative pieces were separate from what DHSS, the division of DHSS. I think what we're looking at right now, and we can use the word explore, right? That is, I think that provides a level of openness, conversation, communication of what it looks like. Personally, I mean, as we all know, running into and running our own organizations, you're constantly looking within. So that should never be off the table of figuring out what's best for an organization. I mean, you have to do a reflective look. in order to make sure that you are doing the job that you need to do. You know, it's just, we're at a point where we've had to now have a live conversation about the department and how to make sure that it is structured so fundamentally folks are getting what they need. And of course, there's going to be lists of dollar amounts and things like that, but this gives the opportunity for that to be explored. So if we are good,
Wait a minute.
okay, Ann, I see your hand up.
I just want to say, if we could just, at this point, given the hour and the time, if I would just recommend that we change number 1 to explore DHSS into 2 departments, and then leave it to the Health and Social Services and the legislative body to determine how that exploration would occur. It seems that most people, if we could just take a vote on that, on changing that, on that recommendation, and then go through the others.
I would agree with explore whether it's feasible or what the, issues, explore the issues and feasibility concerning whether whether the division of Delaware, the DHSS into 2 departments is appropriate, is feasible, whatever. I don't know, Lolita, if you're comfortable with that.
I suppose I still don't understand. This is a recommendation to the legislature. They're going to do something about it. Does that mean if we say anything definitive, there's going to be a bill, to attach a fiscal note?
That's a fair question. I
I'm
don't
still
know.
confused as to what that means. If we're just saying this would be nice if they could do that, that's fine with me. But if they're going to take action without, I can't support it. I just don't understand the process, I guess.
Well, I support it in the spirit of it would be nice if they could do it, but I'm assuming that whatever comes out of this is not a unilateral legislative initiative. It
Right,
would be
and
foolish
that's,
to think that it would be, but it's a fair question.
Well, Lolita, I would go back and say to you, if the legislature was going to move forward, we would have done this a year ago and it would have been just a piece of legislation. So instead, what we developed was a conversation in order to show support and to understand how the operations and the policies, procedures are working for the people in the state of Delaware. So I think going back to the explore word offers a level of ability to still continue a conversation and certainly allow the secretary to define, and if her stance is still, or his stance, whomever the secretary is, whether it's today or 5 years from now, still has the ability to be able to say, hey, there was a recommendation for us to be exploring what this looks like, and maybe now's the time.
I remain unpersuaded that this is necessary or the right thing to do, but I guess I'm trying to be, a team player and understanding that Nicole probably wants to try to land this plane. I do too, and I don't intend to buy a ticket on the next one. To try to couch where I am, I'm trying to get us to a point where we can reach closure.
Sure. Well, I think Mike, I think we just go to the vote. It's either, can everyone accept the wording of explore and we move forward so that way we're at 10:35, so we can move through the other recommendations. Also including Secretary McGarrick, that there will be some type of report. We'll add that at the very end, that you can provide something to the General Assembly by this time next year of, and if that's a reasonable time period, we can certainly talk about what that looks like.
Well, again, Nicole, I don't think just the word explore does it. I think it's got to be couched, with, explore whether it's feasible, whether it is makes fiscal sense, however you want to characterize it. But I'm trying to get closer to where Lolita is. If we can't get there, then maybe we should just have a vote and see who's for it and who's against it.
May I make a motion that states that we explore the feasibility and the cost benefit analysis as well as the social impact of dividing DHSS into two departments.
And I'd amend that to anywhere it says create or.
I'm not going into that. We're just doing the first one at this time. It doesn't say create. It's it's the first recommendation that we're on.
I understand, but I'm saying I think that would be beneficial for the other ones as
Okay, but
well.
I'm sorry,
And then
but
you could vote at once.
as a point of order, we were just on the first one according to the chairs. I'm sorry, I was just following the process, Carolyn.
Yeah,
I
hear
just
that.
made a
think
motion.
Okay, all right, you made a motion.
I'll second it.
Okay, so all in favor, we're gonna have to raise our hands. Can you please count, Alexa?
I believe I see 10.
Okay. So motion has passed.
Yes.
All right, so are there any other questions in regards to this? And if not, we're going to move to the next set of recommendations. And I promise each and every one of you, we are not trying to shortchange your time. But hopefully, worst case scenario, we will have to make a second meeting, but we are running out of time. We want to make sure that this report is done timely. Representative Johnson.
This is the last time I am going to say anything regarding this anyway. Can we have that same type of language for the recommendation as it relates to the consolidation of the other divisions? And also take into consideration all of the work that has been done by the DDDS task force. And I will accept, and that you would just, do a similar rewrite. I'm not asking for a whole conversation about it. I believe I've made my point very clear as to, not negating all of the work that's already been done by another task force.
Absolutely.
Thank you so
So not a problem. I'm going to take the lead on this one and ask for a motion with the same wording that we have used for recommendation 1.
So moved.
So moved.
All in favor, please raise your hand. Okay. Alexa?
Yes, there was about 11. There was more than needed.
Okay.
And we have the recording.
I'm not sure.
Okay, wonderful. Okay, thank you, everyone. See, that's what's so great about this task force is that it is a lot of conversation. This is not done without thoughtful comments, commitments, and making sure that we are recognizing that we do great things, but we can always raise the bar. So going into contracts.
My dog has decided to start barking her head off at this exact moment. So I apologize if it gets very uncomfortable. I thought our subcommittee was inundated with data until I saw service to consumers. So I have a thorough respect for the amount of inflow of information that the previous subcommittee had to process. I want to thank, and I have before, but I want to profusely thank my subcommittee members that span service contracted partners that spans many of the divisions of DHSS. There's my mosquito ranger that's coming outside my window. So again, I apologize for the noise. So with that, again, gratitude to the department for the data requests. Data requests that we've asked for the last year and a half, and then the clarification of data requests that we've followed up on. The DHSS staff that made themselves available to us over that time period was so beneficial and so incredibly instrumental in reaching the conclusions we have here. So when our subcommittee was putting together the recommendations for contract subcommittee, you know, a couple of the drafts were much lengthier when they started out, providing that sort of background that you see in the previous report that we just reviewed. So if there's some gaps in you know, context that you all will need, please let me know. I'm happy to provide them. But I'll go right into them, knowing time is of the essence. So the first one is the contract management system. We kept this in there because it's crucially important. Much of this is being done already from the time that we started our work in 2019, which was not last year, which I have to keep reminding myself of. That was the number one thing we heard from DHSS internally, was that contracts were all on paper still. And in that interim of just the first 6 months, they did get something up software up online. I think it's being used more and more and utilized more and more, and that made, you know, that continued reporting back from the department made the contracts committee very happy. I think the recommendation stands, though, that the department should continually look to centralize and make most efficient the contracting system for not only the department, but for the contracted partners as well. When we started the work, I think there was something like 2,100 contracts in the first half of the fiscal year. That is an extraordinary amount of work that is not centralized, or, you know, at the time, 2019, 2020 was not online. Certainly when we moved into working remotely and quarantining, that became, of course, critical. Let's hope we don't have to revert back to that again, but nonetheless, that is a necessary progression of technology. Something that keeps coming up with whether it was the members of the committee or conversations I have with my other, you know, my full-time job, is that, you know, if there are ways to utilize any, you know, modalities in that software or additional softwares that make everybody's the tedious work of contracting, you know, necessary documents that need to be updated. If there's ways to standardize that or create portals for contracted providers so they're not duplicating those efforts for each and every contract, knowing that the contracted partners have multiple contracts, even across divisions, where that is applicable, would be very much appreciated and a significant movement towards efficiency. The other piece was the renewal of contracts and the changing of contracts. When we started, there were many contracts that were evergreen, many contracts that were not renewed, and services were being provided without a valid contract. That is not the case anymore. There have been significant improvement in that area within the department, and we're thankful for that and happy to see that. But nonetheless, the recommendation that's where the department moves to is still critically important and our number one recommendation. Our second recommendation is in regards to the standardization of indirect and overhead costs. There is a standard set by the state. Oftentimes it's below or above, and where they're above, we're not trying to negate the ability of providers and certainly the department for negotiations, but we think there should be a standardization. The members felt that standardization should reflect the federally negotiated indirect rates, but that the rates shall reflect, and more importantly, the real true current costs and operational needs of the contracted partners, which is, one of the less flashy but equally important arguments to funding at the provider level, is that they have to cover their costs, and people are probably severely tired of me saying this, but we wouldn't pay less to other contracted partners with the state. If it costs $5, the reimbursement after you negotiate a contract, that price should be honored, and indirect costs are an important part of that. Third recommendation was something that came from a thorough review of the contract the department, across divisions have, which is the reliance on external professional consultants to carry out the work of the state. Professional consultants are important. You can't house all expertise within state government, nor should you. But historically, after the recession in 2008, and the trimming of government to meet the fiscal demands of that recession, levels have not been increased. So the capacity to do the work isn't there. And I think we've heard that in the previous recommendations a little bit, and I think we'll hear that in future recommendations, that personnel of the state should be reflective of the operations of the department as well. However, to give one example, there was a lot of money that came in over the last 4 years to address the opioid epidemic from the federal government, a lot of money. And there's not necessarily, and we haven't seen an improvement, obviously, in overdose rates, and there's a lot that goes into it. I 100% understand that. But for over $90 million that came into a state as small as we are, not enough of it got it to the community. And I understand that that's a lot of money coming in, and that you need help spinning that out into services and into output. I think that the committee would much rather see professionals with the expertise to run service systems in various divisions, rather than national professional consulting agencies running services and programming long-term in divisions. And I think that is when you employ a Delawarean to do that work in state government that has the expertise, I think that is a better use. And I think we're being better stewards of money, of the state money and of federal money, when we do it, when we make sure we do that when it is applicable. I'm not saying every professional consultant contract needs to be canceled or we never should have it, but long-term consultants running services and programs, I think, needs to be trimmed down. And the committee really felt that if we're experiencing funding shortages, then we should be creative in how we're using existing money as well. And that was one of the efficiencies they noted. Recommendation number 4, the department shall establish a mechanism to independently review concerns by service providers in an effort to improve its contract management effectiveness and its partnership with providers. This mechanism shall be established to review these concerns in a manner in which contracted providers will not be negatively impacted due to raising concerns. The mechanism will be objective, would provide opportunities for continuous improvement, be transparent in identifying areas that need to be addressed, and hold the department accountable to the policies and practices it values. More specifically, the mechanism shall ensure contracted providers be entitled to independent representation in each step of the grievance process. Providers have an independent representation at each stage of the investigative process, and providers should not be intimidated or suffer reprisals as a result. And that is a result and not necessarily reflective of the current standing or current administration, but historically, that in previous administrations or previous leadership that had been the case, and we're not moving towards efficiency or effectiveness if everybody, if parties are afraid to advocate for themselves, for their organizations, and ultimately the Delawareans that they serve. Recommendation number 5 is another annual report. Specifically though, this one for contracts. I think one of the things we found in digging through all of the information that the department was able to provide us was that there isn't a regular look over of some of this, and with resources being scarce, with providers closing, with just a lot of unknowns, I think more transparency is always better, and that's the purpose and spirit of this report. The annual report shall analyze contractual and procurement efficiencies and effectiveness across all divisions, shall provide an evaluation of, but not limited to, because again, I don't purport to know everything on the department side, and there certainly might be other aspects that are equally important, including average length of time for payment to all vendors by division and line of service, tracking by division of contracts, including type of contract, for example, service provision, professional consulting services, supplies, etc. The medical loss ratio from the prior year, that's specific to Medicaid and the MCOs. They often don't use all their Medicaid dollars that are contracted to them. Understanding what is used and in what service lines, I think is important, certainly as we're looking at healthcare benchmarks and understanding where the healthcare spend really is. I say this quite often, but I think that our community human service providers that contract with the state, specifically in community services throughout the department and throughout the divisions, I feel they get, the committee very much felt they got lumped in with larger health systems that lead to certainly higher costs and drive those higher costs, whereas we keep communities healthy, and ultimately investment in those services is a cost savings. So tracking those Medicaid dollars and finding out where they are, I think, is an important piece to this. So the analysis of total Medicaid and Medicare dollars received, and then a breakdown of the spending that goes to direct services across divisions, percentage retained by the MCOs and percentage retained by the state for administration of directed CMS monies. And then finally, one of the most important pieces is a breakdown of Fmap, of federal medical assistance percentage dollars. There's a lot out there. When we underfund services that are matched by Fmap, we're leaving a lot of money on the table, money that can be cycled through our state economy, and money that can employ Delawareans, money that can employ Delawareans and get off additional state and federal assistance. So I believe that I understand and appreciate and respect the work that will go into this. But I think it's a valuable piece of the pie that we aren't necessarily seeing. And then finally, a guiding principle in the spirit of contracts for equity and fairness. Contract Subcommittee of the Department of Health and Social Services Reorganization Committee recommends all contracts under the purview of the department shall be considered and awarded, and contract provisions shall be applied without discrimination as to race, color, national origin, marital status, age, gender identity, gender, sexual orientation, religion, and disability. And that list was very thoughtfully put together by our subcommittee members, and I very much thank them for their input. It was a extreme team effort, and that's where we are.
Okay, so then if I can ask the committee, are there any questions or concerns? I saw Mike's hand go up first and then Ann.
I sat through several of the committee hearings. I thought this committee did exceptional work. I think it identified longstanding inequities and problems. So I'm prepared to move the adoption of all the recommendations, but I have one question for Carolyn, which is recommendation 5 just strikes me as really, really, really specific. And I'm sure it's intended to be that way. Would you be open to something like the department shall consult with stakeholders to provide an annual report? And then the last sentence, the department may include an evaluation of, but not be limited to. The only reason is I don't want to bog this meeting here today down on this particular point, but I'd like to give wiggle room to stakeholders as well as to the department to figure out whether all 5 points here as articulated really work. They may, and you guys know better than I do, but without one caveat, I think this is well done, addresses longstanding concerns of the provider community, and I would be prepared to move its adoption.
Devona.
Sorry, Anne, and then Devonna.
Sorry.
My concern is with recommendation number 2, because I'm not certain that that can actually be implemented as written, given the grant funding sources from federal grants, and federal funding sources have their own standards around the percentage of admin overhead that is allowable or profit that's allowable, as well as indirect cost rates. And so I have some, I understand the intent and the spirit, and I appreciate it because it's very important. As chair of the board of First Aid Community Action Agency, it certainly is a factor for us, but I also know that funding sources do dictate what is, and that DHSS may be out of their control to implement.
Well, I guess I would first to answer Ann and then go back to Mike. I would ask, I guess, Secretary McGarrick if that is achievable. I was very cognizant of what we want versus what's allowable, understanding federal regulation. So we went with the federally negotiated indirect rate. I think certainly if we can amend that to say as dictated by federal funding guidelines or whatever the restrictions on the source of the money coming in, of course. But as a standard, they felt they needed to be a benchmark. So if there's another guidepost other than the federally negotiated rate, I'm certainly open to that. But I think the secretary would probably have a better understanding of the standard there. But to Mike's point, and again, I think this would go back to the secretary too, how achievable I realize there's a fair amount of work in this, but this is most of this is things that they have to keep track of already. It's just a matter of making that information available to stakeholders, whether that be the General Assembly or their contracted partners or the public, I don't know. But for the most part, all of this information is already calculated and done on a regular basis. It's just being more transparent to the contracted partners with the department.
Sorry, excuse me. I would agree with Ann's point, and maybe it's a slight modification of number 2, just because I think the spirit is what I took away, that variability just for the sake of variability is really what the committee was trying to get away from. It was, again, the focus on more consistency, not having this division does this, why does this do that? But I think there could be a caveat in the language subject to, any different amount or predetermined amount as a prerequisite for a federal grant. Because we do see, that is unfortunately where some of the silos and the bifurcation of services comes from is our federal friends who, or grant recipients who are like, that's great, you do this, I want you to do it this way. So I think the spirit could be honored with, again, a clear caveat that if we should move to standards and benchmarks where there are deviations, it should be dictated by the funding source. There should have been a conscious decision. We want this grant funding. We're clear with our partners. This is what the indirect rate says. This is why it varies from the benchmark, as opposed to we appreciate the perception right now is that it's haphazard and there's not that level of intention or standardization.
That makes perfect sense, Secretary. I have no problem with that change.
We'll say it will be a process.
Yes.
It's not a light switch, but I think, again, the spirit is well intended and I think consistent with the previous subcommittee's efforts.
If you look at the first sentence, not to belabor this, but something like the department shall undertake to standardize, comma, to as much as may be allowed by applicable federal funding guidelines or something like that. I think the rest of it works. And I think that captures the spirit of what you guys are trying to get at. So shall undertake to standardize to as much as may be allowable pursuant to applicable federal funding guidelines. Something, again, something like that. I throw that out for Alexa's benefit because I know it's hard to track all this, if that's acceptable to folks.
Yep. Yeah, we want this to be achievable. More than anything else, that's our goal.
Anne, I know your hand's up.
I also think, Molly, recommendation 6, aren't all contracts already embedded in this language? There's federal guidelines relative to equity, fairness, and discrimination. Isn't this embedded boilerplate language that's included in your contracts?
It is, but again, rightly or wrongly, I took the intention is that there should be extra efforts to ensure that we are living by the standard boilerplate. But yes, these are the goals and these are the language. But again, I think as has been said on multiple topics, there's always more that we can look to do, understanding that this really is the gold standard.
My thing is, having gone through a FOIA request and an RFP challenge with you and your organization and the process around fairness and equity, I appreciate that, but I also have some concerns when we put out a recommendation like that. It does intimate that there's an embedded or inherent systemic failure in meeting these guidelines.
I appreciate that.
Okay, so I hear, oh, I'm sorry, Devana, my apologies, please.
That was my comment, similar to Anne's, that there is already language about that. And I would just say that maybe a way to add to that would be to state, to ensure compliance with existing requirements under procurement and the Office of Supplier Diversity. I think that would strengthen the language, but also get away from the implication that perhaps the current system is not fair or that there have been problems, but thank you.
And that wasn't the spirit of the, excuse me, wasn't the spirit of the recommendation.
I think that I understand the intent and the spirit and the aspiration for a gold standard, but when people look at this report, they're not going to be able or be privy to the context or spirit. It's the way that it's what's written.
Sure.
Okay, so Alexa, can you just read back the wording so we make sure that we have it clear to the changes?
I was going off of the recording, so I do not have that written down specifically, but Mike, if you want to repeat what you had just said about the changes to the reporting.
I said that
the overhead rates.
it's the first sentence in recommendation 2, the department shall undertake to standardize, I guess it was to the fullest extent as may be allowed by applicable federal funding guidelines.
I would just say applicable funding guidelines, because again, there may be grants or others, so.
Okay, so applicable funding guidelines, and then you'd go back to the overhead and indirect cost rates used in contracts throughout divisions.
Oh, shoot, sorry, I was on mute. So are we in favor of the new wording?
For recommendation number 2.
Yes. All in favor, please raise your hand. Okay, so we're good. All right, any other wordsmithing in this in these recommendations?
I think there was additional wordsmithing with, Ann, do you have it?
Yeah.
Or Devana with respect to number 6?
You're muted, Ann.
I would say that we just take it out. I don't support it.
Devana?
My suggestion was to state to ensure compliance with existing procurement and Office of Supplier Diversity rules or regulations with respect to discrimination.
Okay, so we did not go to a motion with it, but we have 2 differences of opinions. Ladies, is it the wording or the removal?
I'm comfortable with changing the wording so that it is not only achievable, but perception and meaning appropriate. Whatever Devana just said.
Okay, so I'm going to go to a motion to the rewording of this. All in favor? Can I get a motion? I see Sheila gave me a motion.
So moved, yes.
Ann gave me a half wave motion. Okay, motion.
No, I favor that.
Okay, great. So all in favor, sorry, raise your hand. Looks great. We have the votes. Okay, so seeing no more, we're going to move to compliance and national best practices. And John, I hate to give you a ton of pressure to talk fast.
Oh, I can do
John
that.
can talk fast.
John can talk fast, and we'll see. Before I do, I will need Alexa to pull up the
Yes.
so I can be semi-coherent at least. Before I talk about the substance of this, I wanted to give great thanks to both our subcommittee and my co-chair. Many of you will not know this, but my co-chair, Christina Crooks-Bryan, is unfortunately not able to be with us today because 2 weeks ago today, she had her first child, a baby boy. I will tell you, in the middle of it, she texted me from the hospital as she was going in. I did discover her son's name. Her son is James Lee Bryan. And so congratulations to Christina and her family. I will say that she did the yeoman's work on this. And while I'm presenting today in her absence, almost all of the credit should go to her. Of course, any blame for errors goes to me because that's how this works. And I'm completely familiar with that. I mean, not familiar with that, comfortable with that. So that will be fine too. I also think I do think that while our recommendations are not trivial, I do want to take a moment to thank Anne and her subcommittee. A lot of the work they did spread across all sorts of areas, and I think was incredibly meaningful. All right, we'll dive in, and I will move very quickly. I'm not going to go into them into massive detail of these. They were not particularly controversial within our committee. There's a couple of things at the end that were more controversial. We think that the current structure, and I think, no, it's not going to be a surprise. It's balkanized or siloed, whichever words you want to put in it. And we think that each, and this is a slight exaggeration, but not much, each division has to some extent acted like its own country or its own fiefdom or whichever sort of rhetoric you want to put into it. And we think that there should be some significant addition of resources to the secretary's office, which is, we think, completely underfunded for its role of trying to supervise and coordinate and work collaboratively and collectively with all the divisions under. I don't think this is, there's no nefarious intent here. But I do think that the Secretary's office half the time, not half the time, but some of the time doesn't know what the divisions are doing independently. And I will tell you the divisions don't know what each of the other divisions are doing. And so this was the reason for these specific recommendations. I'm not going to read them all. I think that doesn't make any sense. The one I do want to point out is we thought that because the Division of Management Services does not exactly have a separate substantive area, unlike the other divisions, which again, at the edges, there's some overlap, but we thought that DMS should be brought directly under the Secretary's control. So that is recommendation number 1, which is giving the Secretary's office more resources to ensure better coordination. Recommendation 2 came in significant part from DHSS itself. We had heard that some of their fee generating mechanisms have not been updated in the Delaware Code, and we think that there needs to be a thorough analysis of the code to look for outdated, inefficient, duplicative, or unnecessary requirements so that that can be coordinated. And then also in particular areas, perhaps give DHSS rulemaking authority so that it doesn't have to be changed by changes to the statute, but can be done by rulemaking, which again would be obviously subject to notice and comment in the way that rulemaking is. So it's not to make it less transparent. I understand at some level that is at a big governmental level, moving some authority away from the legislature to the department. And I understand that that might be a sort of a somewhat issue, but we think it's important to give them more rulemaking authority. Number 3, and which I think is really very important, and I think has been echoed in some of the other committees. This is not a Delaware specific problem. I mean, it's a problem in Delaware, but it is not a Delaware specific problem. This is a national problem. The workforce, particularly the workforce that supports in the self-care, the self-directed care model, where consumers hire people to provide important and necessary and life-altering services to help them stay living in a community and not be institutionalized. Very difficult environment. It is very difficult for consumers to be able to find workers, even to staff the hours that they have been medically approved for. And so we think that there's a lot of room for improvement here, including and especially increasing the reimbursement and salary rates for these providers. We've heard lots of discussions. We had lots of indications of how the providers, the remuneration is not sufficient, and that's why they have a shortage. For example, especially with, for example, nurses. There's not enough money paid so that they can staff the hours that people have been able to get the services they've been approved for. And we understand that DHSS is also, this is not us versus DHSS. This is a known problem that DHSS is very much involved with, but we think it's of huge importance to consumers and needs to be dealt with. And then the little one on there I see is additional resources. It would probably be better if we got rid of that word after additional. That would be a little typo by me. For the Division of Healthcare Quality, which oversees the healthcare facilities throughout the state. We think they're under-resourced. Number 4, and we think this is largely in the process of being accomplished, which is to strengthen early childhood governance. And there has been, historically, a sharing of responsibility between Department of Education and DHSS. And there is, I believe it's, moving idea from Part C to DHSS, effective 7/1/23, and making DOE the lead agency on the child CDBC. I won't even say it. The Child Care Development Block Grant. We believe that these are in the process of being accomplished. Number 5. And I do think Dr. Farley's subcommittee sort of did a significant amount of work in this area, but we do think there needs to be a needs assessment in the same way that if you all go back to the very beginning of our meeting, of our meetings way back pre-pandemic when DHSS was in the middle of doing a self-assessment. But that was an internally facing assessment. It was not a consumer-based needs assessment. Again, I'm not trying to, not disparaging the value of the internal needs assessment. I think that was important. I do think they need a detailed consumer-based needs assessment needs to be done. And I will say, much as I agree with, we don't want to unnecessarily farm these out, this is probably one that would need to be farmed out. I'm not sure that I think it would probably be one that would be better to be done by a contractor. The number six and 7 came in late. These were not for anybody's fault, but these are issues that developed, after our break. Number 6, we were able to agree upon, which is, and we believe that this is in the process of happening, that there should be a work group with appropriate stakeholder representation to evaluate and address EPDST compliance issues. EPDST is the early periodic diagnostic, I forget what S is, and treatment. Basically, it's provision of services to children under the Medicaid program, and there have been issues with compliance. Not just in Delaware, but Delaware and other states, and that's something that needs to be addressed. And then number 7, and we didn't feel like we could do anything more specific with that in the time that we had, because it came before us very late in the process, not through anybody's fault. Number 7, we had a majority and a minority view. The majority view was that DHSS should work with the Childhood Lead Poisoning Advisory Committee to address the treatment of children with lead poisoning issues. We understand there's a task force. And the minority view had two much more specific recommendations. It wasn't that the majority view opposed those in a substantive way. It's just that we did not feel that there was sufficient time because that issue came to us after we reconvened not post-pandemic, but post our pandemic shutdown. But we wanted to acknowledge that there was a minority view on our committee that there should be specific recommendations about those 2 issues. And then there were some other further issues that came up that we think would be subject to study and investigation by the department, which would be transportation efficiencies, care coordination, peer support services, and services for the chronically homeless. And I'm hoping that that's enough so that folks can understand what these recommendations are. And now I will be quiet.
Absolutely. Well, John, thank you very much for all that you did. Also, Carolyn, same for your group as well. It's always good to have best practices and to understand, the things that we can do, but also what's happening nationally and things that can make us stronger. Secretary McGarrick, I see your hand up.
Yes, I just wanted to add what I think is a clarification / update. With respect to 4B, the Child Care Development Block Grant, we have had some conversations with our federal partner. It's Administration for Children and Families under Federal Health and Human Services. We are not able to separate the Child Care Block Grant from the rest of the federal funding. This program, it's called Subsidized Childcare on the federal level. It's purchase of care in Delaware. It is funded with general fund, TANF dollars, and the block grant. And so we've had a lot of good conversations. We've had an MOU signed that moved the quality portion of the spending over to DOE because of the Office of Early Licensing. We've actually now have DOE, the new Associate Deputy Secretary, sitting with DHSS, specifically the Director of Social Services, as co-administrators of the block grant. Again, to acknowledge that we have a valuable perspective as the social service agency. DOE has a valuable perspective as this relates to readiness and in getting kids everything that they need. But again, absent anything changing on the federal side, we can't bifurcate the funding. So respectfully would have an issue, not with the spirit of the recommendation, but we would not be able to implement that absent some larger changes in legislation. So I just, again, not to be disagreeable or to say that this was wrong or incorrect, but just to provide an additional level of detail and an exciting update that it's now co-led co-led to again acknowledge and appropriately integrate the thinking and the planning. And then I know Senator Poor, you led an effort to move childcare licensing. So there's a lot of really good moves on governance consolidation happening, and we are absolutely at the table and supportive of that integration and streamlining.
What is, do you have, is your suggestion just to remove B or to put language in to reflect co-lead agencies?
I would not be so presumptuous as to assume what the intent is. I think.
Well, given what I hear you saying is we can't, notwithstanding this recommendation, you can't do it legally. So, I was just asking for some technical assistance from your side, something that makes you comfortable with it to keep the same intent, but to not have you run into legal problems with the feds.
Sure, and co-lead is exactly what we're doing. So we could be like, check, have done that. So there are other ways to address it. That's where I'm struggling with my answer. There has been governance consolidation language. So I want to be transparent that that's an option here. But as it stands right now with the fact that we run the subsidized childcare program in partnership with DOE, the best we can do with that continued governance structure is co-lead. If there were changes in that structure, then this recommendation could be valid again.
So Molly, can I just restate this? So we would want Department of Ed to be the lead agency. Is that, can we word it that way? We remove the block funding part of it, but can we word it so that Department of Ed becomes the lead agency?
I think to the extent that this is a reflection of best practices and this committee would like to see that,
yeah,
that language is obviously very appropriate. DOE must become the lead agency. That's where we hit this stumbling block because Division of Social Services under DHSS uses our general fund, not ours, the appropriated to DHSS general fund money, as well as the appropriated to DHSS TANF funds as actually the lion's share of the funding. This block grant represents the smallest bucket of spending, which is why the feds are saying you can't pull that over here into another agency and divorce it from the larger administration of the program.
Okay, so could it be changed that if we moved it, then DHSS, because I know other states have done it this way, that they can actually bill DOE for the social services work, and then DOE sets the childcare policies.
So what other states, you're correct, there's lots of different ways to slice and dice this. What Maryland did as the closest agency, I think, to us, is their health and social services program retained the eligibility for it, because we don't want to force like, oh, you can get all of your benefits here, but go over there to do the eligibility, again, to the human-centered design concept. They kept the eligibility, but then moved the actual administration of the childcare program, including funding, over to their Department of Education. So that is something that, again, they don't want the bifurcated governance where the program is being administered and 90% of the funding is in one agency, and the feds are essentially having the block grant be in another entity that really has no authority to run the program. That's really the sticking point.
Okay, so and I'm going to keep challenging this a little bit, right? Because if you think about it, DHSS in this particular arena wouldn't have the expertise, whereas Department of Ed would certainly have the expertise to set the childcare policy. I mean, and I could be speaking on a term, but that's what I would think, right? I mean, related to our kids.
I think the challenge is, and I appreciate that this is again where we get into sometimes the federal government and their intention for programs. Maybe whatever. We have basically the feds and their intent for funding, and then it's the state, and maybe we want to do something different. The federal government considers subsidized childcare a workforce support program. They do not necessarily consider it early childhood education. They look at it as to get individuals off of benefits. Understandably, a parent who has no childcare options is no rational person is going to say, I'm going to go take a job and I'm just going to leave my kids wherever. And so the feds intend this not to be necessarily an early childhood program, but really a way to support adults, not necessarily the parents, but adults who are caregivers to be in the workforce. And they understand that childcare is a significant barrier and one of our social determinants of health if people don't have high quality care. Obviously, we view it, and I think the feds do too, which is why they say a certain percentage of the program is around quality and investing in early childhood. It's a both and for our state. It is both a adults work, but it's also, we want it to be integrated and part of our high quality early childhood education system. So that's kind of where you have this bridge between the social services side and you know what we want the system to look like, which is again high quality early childhood education.
So let me ask this: what if we reword it to do like we've done in a couple of different places, that I don't want to use the word investigate, but that we look into other models, such as like a Maryland model. We explore another model in order to be able to figure this out, because what I'm hearing, and I don't quote me on this, but I'm going to go back and do some research on this. But I thought that under Obama's administration, we had gotten away from the workforce for the child care. I could be completely wrong about that. But if that's the case, what I'd like to do is leave this open-ended, that how about, you know, exploring, especially because it's under best practices, but exploring other models to be able to do exactly what John was asking, not necessarily the federal dollars part of it, the block grant part of it, but the moving of this out of DHSS into DOE.
May I make a suggestion? Senator?
Sure, please.
If you could pull it, let me pull my version back up. Explore mechanisms to allow DOE to become lead agency. How about that? Because remember, this is only in 4B. It's not about 4A.
I think that marries both of the spirit and the points that Senator Poor made around exploring.
Does that work for you, Senator Poor?
That works for me, yes.
Well, then we're done, right? Just kidding. That's not, I'm completely comfortable with that. I think, yeah.
Okay, so I'm sorry, Molly, your hand's back up and your hand's back up.
John, I think your committee did great work, and these are really wonderful recommendations, especially around best practices. And I wholeheartedly do think the Secretary's office increased coordination across the divisions, and all of these sub things that you put in there are excellent. And your recommendation number 5 around a community needs assessment. You know, when our task force had hoped to have persons in need, and we were relying on DHSS to do that. And then they opted, for whatever reason, weren't able to execute on that. But I do believe it's strongly important. Agencies like Dana, First Aid Community Action Agency, and typically engage in community needs assessment to really guide whether the services that are being delivered are really meeting the needs. And so that is essential. And I just really am pleased with your recommendations overall. And I think that they're very strong. So hats off to you and your committee.
Thank you so much.
Sorry, and if I could just add really quickly, we actually are, we have a glitch request into the Joint Finance Committee to do the DMS Secretary's Office consolidation. And we have elevated that director. So again, thank you for the conversation. We completely agree. And I don't want to say mission accomplished, because obviously there's a lot of time between a draft, you know, we're about to head into markup, but we have taken that recommendation and took steps because we heard from the committee and agreed with the intent, and think that gives us a lot of opportunity to also do many of the things that are in other subcommittee reports. So thank you.
And I would be remiss if I didn't note that we got a lot of cooperation and assistance from the department in responding to our requests. And they participated actively with us in a way that was cooperative and helpful. So I did want to mention that.
Okay. All right, so we are going to reword then that recommendation. And based on what John had previously said, are we in favor? All in favor? Alexa, do we have the votes?
Yes.
Alexa off. Okay, so we have the votes?
Yes.
All right, so that recommendation will be updated. Are there any other requests in this area? Okay, so moving forward, are we all good with the recommendations? Please raise your hands. Okay, wonderful. All right, so I am going to, I know that Monica had to jump off. I am going to make this public comment and say that I am extremely disappointed in the personnel group. They have not met. There was really nothing accomplished in that area. And the last meeting lasted 12 minutes to discuss their role. And so what they agreed to is that they would not start recommendations because it didn't make sense until all of these findings came back. And that was not the task for this particular subgroup. So unfortunately, there isn't anything to share under personnel, which I think that there is so much to share and so many ways recommendations could have been discussed. I am sure that the employees of the state will certainly feel as if they've missed out in hearing what recommendations could have taken place in favor of them. And even if, as we've all discussed and we've all talked about it, yes, there are going to be areas that are going to require dollars, but that didn't mean that there was the commitment to spend those dollars. It was the acknowledgement of how to actually do something better for each of the employees as a group and of course, collectively as a whole. So that being said, at this time, I know it's 11:34. I appreciate every single one of you for hanging tight through this whole conversation. I think that we have made some amazing strides. And I think that what we have shown the state of Delaware and the people that are listening is that we may not all agree on every single fine point, but we do agree to work together. We do agree to have a better healthcare system services plan for the people in the state of Delaware. And that's what they want to know. They want to know that we can have these conversations and that we can make things better. So I'm going to open it up to public comment.
For anyone in attendance who would like to provide public comment, please raise your hand. As we are over time, if it's okay with the chair, I would ask that anyone from the public keep your comments brief, preferably maybe to a minute or two. I see Dawn Alexander has raised her hand, so I'm going to allow her to speak. Dawn, you should be allowed to unmute yourself and provide public comment. Dawn? Dawn? Could you unmute? And if not, we can come back to you. Okay, we're going to come back to Dawn, and we are going to move on to Margaret Mitchell. Margaret, I have now allowed you to speak. Could you unmute and provide your comments? Margaret? You are now unmuted. Can you try introducing yourself and see if we can hear you? I believe DTI is on here, but Margaret, we cannot hear you and you are unmuted. I have allowed you to speak. I'm going to try to go back to Dawn real fast. Dawn?
Alexa, can we ask DTI to step in?
Dwayne, are you on here? Dwayne with DTI? Oh, there's Dawn. Hi.
Thank you so much. The settings were originally not correct, so I guess I needed to be elevated to a presenter. Anyway, I just wanted to say I'm grateful that I had the opportunity to participate on the compliance and national best practices subgroup. We worked very hard to come up with recommendations, and I thank Senator Poore and just everyone for doing this work. Will really move Delaware forward. Thank you so much.
Thank you, Dawn. If there are any other members of the public who wish to provide public comment, please now raise your hand. Senator Poore, I'm not seeing anyone, so that will close the public comment period.
Okay, wonderful. Thank you, Alexa.
Sorry, really quick. I was just going to say that one of the people who raised their hand to speak in the public is one of our employees. She had shared some feedback with me. I can double check with her and make sure, and then I'm happy to forward that to you. It was with respect to looking at county versus state in terms of restaurant inspections, and it was actually really thoughtful and appreciate her comments, but I can just double check with her and again, then forward it to the full committee for your view.
That would be awesome. Thank you. Okay, so to the committee members, again, let me just wrap this up and I won't be long-winded. Thank you for all of your time, all of your dedication, your thoughtfulness in how we crafted what this report looks like, good, bad, or indifferent, happy or sad. The reality is that the information is there and we have moved forward to be able to say that conversations can take place. And we've put together, I think, a very thorough, honest report filled with integrity based on the fact that we do want to make sure that we're delivering the services to our constituents, to the people in the state of Delaware, to our loved ones, family members, friends, and making sure that we do that in a way that offers them everything that they need to have a independent life. And so it does take all of us. It does take the government to be able to make sure that we supplement areas that are needed most by the people that need it the most. So we'll put this report together, make sure that everyone gets a copy. We will release it to the General Assembly with all of the findings. And I thank everyone for their time. Mike, is there anything that you would like to say as a wrap up?
Nope, you've said it. Thank you.
Okay, wonderful. Thank you, everyone, and great work.
Thank you.